ADHD most commonly misdiagnosed as conditions that mimic ADHD: bipolar disorder, autism, low blood sugar levels, sensory processing disorder, sleeping disorder, hearing problems, kids being kids. Attention deficit hyperactivity disorder or ADHD misdiagnosis can happen because many of its symptoms overlap with those of other conditions. The symptoms of ADHD, such as difficulty concentrating, restlessness, and finding it hard to respond to instructions, can all arise from a wide variety of causes. Some aspects of ADHD may also be symptoms of other conditions. Due to the complex nature of the condition, some people may receive an incorrect diagnosis. This is due to a wide range of diagnostic issues. We look at some of the factors and conditions that can lead to a misdiagnosis of ADHD. Age related factors. Doctors can misdiagnose ADHD in children due to their age. In fact, children who start school at a younger age more frequently trusted sources receive a diagnosis of ADHD. If a child starts school having just turned 5 years old, while some of their peers are closer to 6 years old, there is an appropriate 20% trusted source difference in age. One study found that children born in December, which was the school cutoff age, were more likely to have an ADHD diagnosis than those born in January. The date a child is born does not affect their chance of ADHD, as it is a neurodevelopmental condition. What this research does suggest, however, is that misdiagnosis can happen depending on the maturity levels of a developing child when they receive a diagnosis. It is also important to note that having difficulty paying attention and being overactive may be normal behavior for children of a certain age. When children lack challenge or stimulation in the classroom, it can manifest as symptoms of ADHD. In these cases, children may exhibit only a couple of the symptoms associated with the disorder. For example, a child may have trouble paying attention in class because they have already understand the material. They may also leave their seat often because they are bored. As you get older, symptoms of hyperactivity, first noted in childhood, may manifest differently. You may have constantly climbed on furniture and roughhoused with siblings when you were a kid. But now that you are an adult, you talk a lot and get restless when trying to sleep at night. All signs of the same ADHD hyperactivity tendencies showing up in different behaviors. Doctors may feel symptoms of hyperactivity have to be present to diagnose someone with ADHD, but this is not the case. Impulsivity and inattention are just as strong indicators of ADHD. Sex. Some research has found that boys receive a diagnosis of ADHD more often than girls, with a ratio ranging from 3 to 1 to 9 to 1 of boys to girls with an ADHD diagnosis. Researchers suggest that this is because girls tend to display more symptoms of inattention than boys. Boys may instead show symptoms of hyperactivity, which are more noticeable. More obvious displays of the symptoms of ADHD may result in an ADHD diagnosis. Research shows that many female children with ADHD are likely to remain unidentified and untreated. Females mask their behavior and socially adapt more than boys. In other words, the behavioral expectations aren't the same among the sexes and lead to misdiagnosis. Women are also more likely to experience the primary symptoms of inattentiveness instead of hyperactivity. There may be why ADHD is diagnosed more in men and missed in women. Boys may also feel more comfortable culturally acting on their whims and being high energy, potentially leading to overdiagnosis. This doesn't mean they have ADHD. Mood disorders. Mood disorders include depression, bipolar disorder, dysthymia, which is a chronic low or irritable mood lasting for 2 years or more in adults and at least 1 year in children. Some theories suggest that mood disorders can occur due to an imbalance of chemicals in the brain, stressful life events, or as a response to major illness or medication. Some symptoms of mood disorders can be similar to those of ADHD, such as difficulty concentrating, irritability, difficulty sleeping. A psychologist, psychiatrist, or other mental health professional can diagnose a mood disorder by conducting an assessment and applying diagnostic criteria to a person's symptoms. Difficulty sleeping. If people experience sleep problems such as insomnia or obstructive sleep apnea, it can cause similar symptoms to ADHD, including difficulty in concentrating, restlessness, daytime sleepiness, decrease in performance at school or work. People with insomnia have difficulty falling or staying asleep. OSA is a condition wherein the upper airway keeps getting blocked while asleep, which restricts airflow. People with OSA may snore loudly, gasp for air in their sleep, frequently wake in the night to urinate. A doctor may take a medical history, carry out a physical examination, and suggest a sleep study during which they can monitor activity during sleep to diagnose a sleep condition. Signs of misdiagnosis. If the prescribed treatment for ADHD is not helping you manage your symptoms, you might have been misdiagnosed. But sometimes your doctor may need to try a few different ADHD medications before finding an effective one. Doctors are human and can make mistakes. But if you try different treatments and still don't see results, you'll want to speak with your doctor again. How to speak to your doctor if you believe you have been misdiagnosed. You can be your own health advocate and talk with your doctor if you feel you received an incorrect diagnosis. Here are some steps to consider before meeting with your doctor. Make a list of your symptoms. Note the severity of your symptoms and what makes them worse. Communicate openly and honestly. When you are clear and honest about how you have been feeling, it can help you and the doctor make the right decisions for your care. Considering bringing a loved one, having a friend or family member with you can ensure all the information is communicated accurately on both sides. Learn how to access your medical records. Today, many healthcare symptoms offer easy access to your test results, diagnosis, medication, and treatment plans to help your understanding.